All right. Hello, Michelle. How are you today?
Good, how are you?
Good, good. I just wanted to follow up. This is our second session. I just wanted to check in, see how you're doing, and then we'll move from there. Tell me how are you doing?
I'm feeling overwhelmed.
You're
The
still feeling
work,
overwhelmed. Okay.
yeah, the work and the school, um,
Okay.
uh, still kind of having a lot of pain. It feels like
Yeah.
it's all over my body, but um,
Okay. All
yeah,
right. What I would like to do, if it's okay, I have you heard of the PHQ-9 form?
no.
All right. That is the PHQ-9. That's the patient health questionnaire form. What it is, it's a sliding scale tool that we use in social work just to if we could put a number or value on how you're feeling so it pretty much levels let us know where you are so in order to determine that and it'll let us know if you have mild depression or slight depression moderate of that nature
Sure,
and all I have to do is just ask a few simple questions. It won't take long. It'll take about 2 minutes. Are you comfortable with us trying that today?
sure.
Okay, thank you. All right, so on a scaling question from zero being not at all and three being nearly every day, where would you rate
Okay.
yourself with little interest or pleasure in doing things? Zero being not at all, and one being sometimes, and three being nearly every day.
I would say about a two.
Okay, about a two. Okay. And how is your appetite? Do you say zero, no appetite, or three, you have a pretty normal appetite?
I would say it's pretty good appetite. I mean,
Okay.
I eat twice a day,
Okay.
so
Okay. All right. And what about trouble falling or staying asleep or sleeping too much? Where would you rate that?
um, I have trouble staying asleep,
Okay.
so maybe like a three-ish.
Okay. All right. What about feeling bad about yourself? Is that like a everyday
Maybe a
thing
one.
or maybe a one? Okay. Okay.
Yeah.
All right. And last question, trouble concentrating on things such as reading or reading the newspaper or watching television. Do you have trouble concentrating?
I have ADHD, so yes, I
Oh,
do. That doesn't count. So yes, for me it's a four or three,
oh, a
whatever the
four.
highest one.
Okay.
Yeah.
Okay. All right. All right. All right. Four. I'm gonna add it up here. All right. So you actually scored at a 10. And what that means it looks like based on this tool that you range from the 5 to 9 and then the 10 to 14. So you're actually moderate for depression. Does that
Okay.
sound about right?
Yeah, I would agree with that.
Okay. All right. All right. So what I want to do treatment plan wise, if you're comfortable, because I know you do a lot. You said you're overwhelmed with school and work and the
Yep.
family and everything. Let's develop this treatment plan together because no one knows you better than you. What are some short-term goals that we can do to have you feeling better about yourself and not being so overwhelmed? What can we do?
Um, I know that one of the things that I do try to do is kind of take time, even if it's like 30 minutes, 20 minutes, to just run away from everybody in this and the noise of and chaos of life. Um, to be able to just decompress, um,
Decompress.
or like, you know, get my nails done.
Okay.
So I try to do some of that self-care. Um, but the one
Good.
reason I guess that I came to counseling was to maybe explore maybe like a medication so that to kind of help like keep my moods a little bit better. So I'm not
Okay.
always feeling so depressed, um, and just, overwhelmed.
Right, right, right. Thank you for sharing that. Let me ask you, have you spoke to your primary care provider about this and explained to him exactly what you explained to me, that you're hopefully looking for a medication to help with the mood?
I did, and that's how I got connected with you guys.
Okay, okay,
He was the one that said that that's not something that he feels comfortable with doing.
okay,
Unfortunately, even though my my mother-in-law's providers do it, so like mine just doesn't. Um,
okay, okay,
so he was the one that actually suggested that I get connected with you guys for
okay.
counseling.
And we can definitely look at that. I'll put the release of information in so we can get those records, and then we'll definitely look and see what we can do for that.
Okay,
So,
great.
question for you. I'm going to ask this question, and it's what's called the miracle question. If you went to sleep tonight and woke up tomorrow and your problem just poof disappeared, what would that look like?
I wouldn't be so like sad all the time,
Okay.
like feeling like I just talk and nobody listens. I want to be able to feel heard.
Feeling heard. Wow. By anyone in particular?
Um, Kind of, and everybody that I interact with, I feel
Okay.
like people look at me, especially the medical fields, and they just see a young person. They
Hmm.
don't see this 47-year-old woman. They look at me and see like this 20-year-old person, but
Okay.
I have a younger personality, I guess,
Okay.
where I can't always take everything so seriously. I'm very outgoing.
Hmm.
So I feel like I'm being judged.
Okay.
So because of
Gotcha.
that, I feel like, oh, that the doctor will sit there and say, oh, it's okay, you're okay. And I just consistently feel dismissed.
Dismissed. Okay. Thank you for sharing that. And I understand that's heavy to feel dismissed, and that is an awful feeling to know that you're speaking and feel like no one hears you. And I want to let you know
Yeah.
I hear you, and I really do thank you for sharing that. So, how do we change the narrative from wanting to be heard to actually being heard? What do we have to do to get you to that place where you feel confident, you feel like you're being heard, you feel like you're being acknowledged?
Right.
Yeah.
Um, I don't know. That's where I'm coming to you for.
Okay. Okay. Okay.
If
Fair
I had
enough.
that answer, I wouldn't be here.
Fair enough. I'll take that. Fair enough. Fair enough.
Um, but maybe like because like I try writing down so I'm not like rambling, what I kind of want to talk about. Um,
Mhm.
I know that when I've come across as, hey, I know that this is what this is,
Yeah.
doctors are quicker to dismiss me. Where if I say, gee, doc, these are my symptoms, what's wrong with me?
Okay. Right.
Um, they come to the same conclusion that I do. Um, so like I've tried a lot. I've tried changing doctors. I really don't know how to improve my communication, or
Mhm.
I don't think that it's a confidence level.
Right. Right.
Um,
Right.
so I really don't know
Mm.
how to get them to hear me.
Right. Okay. All right.
Um, but I know that that takes a lot on my like depression because I feel like, they can't hear me.
Right, right. And I understand that. And it's quite frustrating. Let's just be honest, it's frustrating to speak and feel like your feelings haven't been validated and no one's hearing you. Like they're
Yeah,
listening to you, but they're not hearing you. Like,
right.
I always tell people you know you better than anyone else in the world. So
Yep.
if you're explaining how you feel and what's going on, people need to stop what they're doing and give you that space, give you that respect,
Absolutely.
listen to you, you know. One final question, and then I'll wrap up because I know the hour's getting long. One final question. Zero being the worst, five being the greatest, how would you rate your personal confidence level?
I would say about a 3.
About a three. Okay.
Especially, I mean, if it's in terms of like the medical field, it's a 5.
Okay.
Because I have, medical background. But overall life confidence, I would say a 3.
Okay. Okay. So what I want to do, because we're wrapping up, treatment plan wise, I want you to, because you said if you could take 20 minutes, 20 to 30 minutes a day to decompress every day, have your self-care time. Homework for you. I want you to take 20 minutes a day, 20 to 30 minutes a day to decompress, whatever that looks like. If that means stand in your car for 20 minutes when you get home, before you get out of that car, blast your music and whatever gets you in your Zen mode, I want you to do that. And after you do it, I want you to write down and tell me how did it help? Did it improve? Did it make things work? Or was there no change at all? So, and
Absolutely.
because
Thank you.
and please document that so when we speak again, we can start tracking and seeing what's worked, what doesn't work, or what we need to nix, or what we need to bring more of. Okay.
Thank you. I appreciate that. I'll
All
see
right. Well,
you.
thank you for your time, and I will see you same time next week, Michelle.
Sounds good. Thank you so much.
You're welcome.